A new study looking at the health of Canadian travelers is ringing fresh alarms over the Zika virus. The findings were published today in the Canadian Medical Association Journal, and they suggest Canadians infected by Zika overseas have found it packs a far bigger punch than initially thought. Researchers looked at more than 1,100 sick travelers who visited specialists across the country. 41 of them had Zika. 2 patients experienced partial paralysis. 3 pregnant women were infected, and 2 passed the virus on to their unborn babies, leading to serious birth defects. In total, 10% of Zika cases resulted in severe complications. Joining me now with more on this is Dr. Gio Miletto, who works at a travel medicine clinic. And Dr. Miletto, I think that most of us thought if we were not pregnant or thinking about getting pregnant, Zika wasn't that big a deal. This study makes us think twice about that assumption.
You're absolutely right. It does suggest that there's a lot more to this story than we previously thought. A year, 18 months ago, we realized that Zika in pregnancy could be a problem for the developing baby, and we now understand that very well. This new information suggests that it may not be just about pregnancy. It could involve people that aren't pregnant. It could contribute to meningitis. It could cause increased risk of Guillain-Barré syndrome above and beyond what you'd normally expect from a typical viral infection like, say, dengue fever.
Yeah. So you mentioned 2 neurological diseases there. What could the impact on patients be, and what have we seen?
Well, we haven't seen any fatalities, thankfully, but meningitis is a very unpleasant disease. There is no specific treatment for this particular virus. It is potentially fatal. Other causes of meningitis we know are fatal. Guillain-Barré syndrome, likewise, it can be fatal as well. It causes paralysis, and there is no specific treatment other than supportive care until the body recovers. But that's a usually very risky and serious thing.
And I guess one of the questions is if we can have this virus, because many people, I guess, come back and have little or no symptoms. Not everyone's going to come back with meningitis or Guillain-Barré. Mm-hmm. Could we be spreading it within the population here and then cause other people to have these problems?
Right, so there's a lot of questions that are raised by this study. So bearing in mind, 80% of people don't get symptoms. Yeah. So those aren't the ones that are turning up and getting the tests. We're only testing in BC as well for people with symptoms in pregnancy. So what about everybody else? Because there are thousands of travelers, tens of thousands of travelers from Canada to these areas where Zika is endemic. So should we be testing for those? Because currently we're not.
Should we?
Well, I mean, that would be a massive deployment of resources and cost, and you have to ask the question, well, would that be worth it? That's certainly something that the Public Health Agency of Canada, I think, would want to look at, because it's currently not available to regular returning travelers.
Do we do it with malaria or dengue or anything else, test people, or do we just wait and see if they have the symptoms?
Yeah, currently we just wait to see if people get symptoms. Dengue fever is very rarely serious, so for the most part we just give advice and we identify those people that have it just to gather statistics, but there's no particular intervention typically for dengue. Likewise, malaria, we commonly advise people to take malaria medication if they're going to somewhere risky in order to prevent it. But of course, if people do come back with malaria, then we treat it when the symptoms develop.
So, okay, we've talked about what we should do as a society, but what about as individual travelers? Does this sort of study mean that we shouldn't go to places where there is Zika, that we should go but take precautions, or that we should be especially aware? I mean, what would you say?
Well, the first advice is if you are pregnant or considering pregnancy in the next 6 months, think about whether you need to expose yourself to this potential risk. If you're not pregnant, the risks are low, but again, one has to decide, is this a risk you want to take on?
So do you just not go, or are there special insect repellents or different behaviors that we can have as tourists?
Right, in pregnancy I would ask yourself the question, do I need to take this trip? Otherwise, for other people it's like, wear long sleeve. This is an insect that bites during the day. Okay. So the insect that spreads this virus, Zika, bites during the day. So insect repellent during the day, long sleeves, avoid dark colors which they're drawn to, avoid perfumes which they're drawn to, and deodorants. So one has to take these precautions if you are going to travel to an endemic area, and look out for symptoms when you come back.
Okay, and head to a travel clinic if you do have symptoms.
Head to a travel clinic before you go to try and avoid some of these problems. But if you do get symptoms, certainly consult your doctor on return.
Okay, thank you so much for clearing it up.
Thanks.